Welcome everybody. It's 12:58 p.m. We'll give a couple more minutes for the attendees that are still signing on, and we will start at 1 p.m. sharp. All right, let's get started. Welcome everybody. My name is Pascal and I'm a Knowledge Translation Officer at the Heart Institute. I will be your moderator for today's session. I want to start by thanking everybody for taking the time to attend today's webinar, Living with Heart Failure During the COVID-19 Pandemic. We encourage you to join us every Friday from 1 to 2 p.m. Eastern Time, where we are inviting different speakers to address current and pressing topics for patients, their caregivers, and our community at large. We'd like to start by taking the opportunity to share an important message for patients and their caregivers. If you or your loved ones see a change in cardiac symptoms such as chest pain or angina or unusual shortness of breath, please do not wait to call your family doctor or the Heart Institute. If you or your loved one are in need of urgent medical attention, please do not hesitate to call 911 or to go to the nearest emergency room. Hospitals and their emergency department have taken additional measures to ensure the safety of their patients, so please, we ask you that you do not ignore your heart symptoms and do not be afraid to seek urgent help. A few housekeeping notes before we get started with the presentation. First, we'd like to inform everybody that we've muted all participants and turned off video sharing capabilities in order to minimize disruption. Please use the chat function to notify presenters and moderators of technical difficulties only. If you have a question at any point during the webinar, we welcome you to type it in the Q&A section. You'll find the Q&A button in the bottom black bar of your Zoom window. We will be moderating the questions coming in and will reserve some time at the end of the session to address as many as we can. We'd like to note, though, that due to the public nature of this platform, we ask that the questions be general in nature. If you have a more personal question, we encourage you to contact your healthcare provider for a more personalized answer. We would also like to let you know that this session is being recorded. We will be uploading the recording on our website at the end of the session, so please visit our website to view these. We will be putting up a link at the end where you can find the recording. Finally, we would like to let you know that there will be a short follow-up survey popping up in your browser when we end the webinar. We'd like to encourage you to fill it out as we take your feedback seriously and we use your comment to improve the educational experiences that we offer. We'll also be sending the survey by email in case it doesn't show up in your browser, so please keep an eye out in your email for that survey. So without further ado, I would like to introduce today's presenters. First, we have Lindsay MacArthur, a heart failure transitional care nurse at the Heart Institute. Then we have Anne-Marie Luc, who's a registered dietitian in the Prevention and Rehab Division. Then we have Regan Kiefer, who's a senior physiotherapist in the Prevention and Rehab Division. And finally, we have Dr. Carolyn McGinty, who's a cardiologist at the Heart Institute. So I would like to now hand it over to Lindsay to start the presentation. Lindsay.
Hi everyone. So I'm going to be discussing more the signs and symptoms and the medications related to heart failure. So I'll just go with the next slide. So fluid retention is the most common reason for a visit to the emergency room for somebody with heart failure. Many times this fluid or congestion is due to eating foods that are high in salt or sodium. So you can see on the picture there, it illustrates kind of what fluid retention would look like. I'll just go to the next slide. So it's really important to keep an eye for your heart failure symptoms every day. If you do not have the weight tracker tool at home, you can find it on our website at ottawaheart.ca and search the heart failure stoplight tool. So here's the image of the stoplight tool that we use here. So ideally we like for our patients to be in the green zone. So no weight gain, no swelling, no shortness of breath, no chest pain, and normal activity. So this means that your symptoms are under control. So you just keep taking your meds as prescribed, continue to do your daily weights, and continue to follow a low salt diet and a fluid restriction. The yellow zone is when you start to get more worried. So that's weight gain of more than 2 pounds in one day or 5 pounds in 1 week. You start to get more of a cough, you get more short of breath, you're waking up at night short of breath, you can't lie flat to sleep, and you get more swelling in your hands, your feet, or your stomach, or anything else unusual that bothers you. So in this case, your medications might need to be adjusted. So you're going to want to either reach out to your cardiologist or your family doctor. There's also the 24-hour number that we have. So it's 613-696-7000. You dial 0 and ask to speak to the nursing coordinator. It's really important to also watch for the red zone. So that's unrelieved shortness of breath at rest, wheezing or chest tightness at rest. You need to sit in a chair to sleep, or you're feeling confused or disoriented. So that's when you need to go to an emergency department and see a doctor right away. Next slide. So it's important to weigh yourself every day. So if you don't have a scale at home, you should try to get one. Try to get a digital scale with large numbers to make it easier for you to read. Next slide. So when you leave the hospital, you're going to bring your old medications to the pharmacy with your new prescription so they can help you organize what you should be taking. So you're going to ask your pharmacist to check all of your over-the-counter medications before you start taking them. It is important to also renew your medications when you run out. If you're getting close to running out, contact a doctor. Take your medications every day and do not stop them unless your doctor tells you to. These medications can improve your heart function and can help you manage your symptoms. They're very important. Next slide. So one of the first medications I'm going to talk about is an ACE inhibitor. So the examples of that are perindopril, ramipril, or enalapril. So this medication helps to dilate your blood vessels. It improves heart function and improves symptoms, and it can lower your risk of hospitalization and a heart attack. The side effects are often cough, dizziness, increased blood potassium level, and another side effect can be swelling of the face, lips, or throat. And this is rare, and you need to call 911 for this. Next slide. Another medication that we often prescribe is an ARB if you do not tolerate the first medication that we talked about. This medication works the same way by widening the blood vessels. It also improves heart function and symptoms and can lower risk of hospitalization and heart attacks. The side effects are pretty similar, so dizziness, increased blood potassium, and headache. Next slide. Beta blocker is another medication that we use. So it's the metoprolol, bisoprolol, and carvedilol. So this medication also improves symptoms of heart failure and decreases the risk of hospitalization. The side effects are fatigue, tiredness, dizziness, lightheadedness, and wheezing. Next slide. One of the main medications that we prescribe for heart failure is the water pill. So that's called Lasix or also furosemide. So this medication helps to take the excess water out of your body, and it'll increase your urine production and make it easier for you to breathe. The side effects, once again, are dizziness. This one will reduce your potassium level, can cause gout, thirst, and dry mouth, and you'll need regular blood work to follow up to check your potassium and creatinine or your kidney levels while on this medication. Other medications that are sometimes used, which the one we see more often is metolazone, enapamide, hydrochlorothiazide, and edacrin. Next slide. An MRA is another medication that we use to help improve your heart failure symptoms. It can also lower the risk of hospitalization. This medication can increase your blood potassium level. It can cause breast enlargement and tenderness. You will need regular blood work to follow up to check your potassium and your kidney levels while on this medication. Other MRA medications that are used sometimes is the Inspira. Oh, next slide, sorry. So remember, even if your blood pressure is okay, and same with your heart rate, do not stop taking the medications without consulting your doctor. These medications all work together to help keep your heart functioning better. Next slide. So if you're having trouble reading your pill bottles or taking your medication, you can go to your pharmacy and ask for a meds check and assistance is how to make it easier for you. You could also ask your nurse or physician to review the medications with you. Remember to tell your pharmacist or healthcare professional that you have heart failure. It is important to take your medications as directed. And a side note is that patients who have heart failure should not take anti-inflammatory medications such as ibuprofen or Advil or Aleve unless under the supervision of a doctor, but aspirin and Tylenol are still okay. These type of medications can cause you to put on extra fluid and exacerbate heart failure symptoms. So your doctor might need to monitor you and adjust your medications while on these medications if needed. Next slide. So one of the keys to managing your heart failure treatment is you. So your participation is really important. You need to weigh yourself every day, eat less salty, low sodium foods, watch your fluid levels, not too much, not too little, attend your follow-up appointments, call your doctor with symptoms of fluid retention in the yellow zone, and do your exercise. And just a side note to please do not hesitate to come to the emergency department despite the ongoing pandemic. And I have a link to the resource for the heart failure guide, which is found online. Thank you very much.
Hello. I'm the dietitian, so I'm going to talk about nutrition and heart failure. So as Lindsay was talking about, so when you have heart failure, your heart's not pumping as strong as it should. And because of that, you're more at risk of retaining fluid. So having swollen ankles, water on your tummy. And the goal of nutrition in heart failure is to help manage that. So to prevent that water from coming on your body and retaining on your body. So I'm going to mostly talk about salt and fluids, which are the important things to watch when you have heart failure. And everything I'm going to talk about is in that heart failure booklet that Lindsay talked about. So we're going to start with the next slide, please, which is about salt. So sodium is the other word that you'll see us use, and it's what's used in the guide. It's what's written on the nutrition facts tables. Salt is made of two things, sodium and chloride, and sodium is what's in salt that attracts water a bit like a sponge. So when you have heart failure, if you eat too much sodium, you'll tend to retain more water. And if you have heart failure, your heart has a bit more trouble pumping all of that out. So if you eat too much of it, you might retain water. So that's why it's important to watch how much sodium you eat when you have heart failure. So the goal and what you'll want to aim for is not have more than 2,000 milligrams of sodium per day. And I'll show you in a second what that looks like in real life. But you want to try to aim for around 600 milligrams of sodium per meal. That way, if you have 3 meals a day, a few snacks here and there, you'll end up getting at around 2,000 milligrams per day. So we can move on to the next slide. So sodium is found in a lot of things. One of them obviously is salt. So 1 teaspoon of salt, whether it's table salt, sea salt, Himalayan salt, any type of salt really, has around 2,300 milligrams of sodium. So that's already more than what you should be having in a day. And that's only the sodium found in the salt shaker. Most of the sodium that we eat is actually found in foods. It's hidden in foods, mostly processed foods. So we're talking about things like canned soups, cold cuts, pickles, chips, frozen foods, like chicken nuggets, for example. So all those foods that are a bit more processed will be where most of the sodium that we eat is actually found. So if you have heart failure and you're trying to reduce your sodium, one thing we recommend is definitely to try to get rid of the salt shaker, because you'll already find a lot of sodium in other foods. So if you eat a lot of processed foods, plus on top of that you add a lot of salt, you're definitely going to go over that 2,000 milligrams limit per day. So we can move on to the next slide, please. So one of the best ways to reduce the sodium in your diet, if you can, is to try to cook more at home. So I know during COVID right now, some people have been cooking more at home. If you're, if you're more at home or you've been working from home, some people we have heard are definitely cooking more. So if that's the case, that's great. Cooking more at home and making more of your own homemade foods typically helps reduce the sodium in your diet, because you know more what you're putting in the food, and you can adapt your recipes to choose foods that are lower in sodium. Okay, so for example, if you're making a recipe that asks for, canned vegetables, well, you can maybe substitute for frozen vegetables. That way you're reducing the sodium. So things that are more homemade, home cooked, are typically lower in sodium. So for example, if you compare a bottled salad dressing with a homemade salad dressing where you've made your own salad dressing with some oil, vinegar, the homemade salad dressing will typically be lower in sodium. If you compare a homemade soup where you've made your own broth, you make your own soup, you compare that with a packaged soup, the packaged soup will be higher in sodium. It's more processed. If we're looking at any type of meat, for example, like if you're cooking fresh meat, like you're making a chicken breast in the oven on the barbecue, you've added a few like herbs, for example. If you compare that to a more processed meat like ham, chicken nuggets, or fish sticks, the ones that are breaded, those will typically be much, much higher in sodium because they are more processed. So if you can, try to cook more at home, because it does help reduce the sodium a lot of the food that you're eating. We can go to the next slide, please. So for, if you can't cook at home, or there are some things that we just, tend to buy because it's harder to make, and we do rely on some things that are, a bit more packaged sometimes, like, things like bread or stuff like that. Not a lot of people make their own. We do recommend that you start reading food labels if you can at the grocery store, because that will tell you how much sodium is in the food that you're buying and that you're eating. So there's a nutrition facts table on pretty much anything you can buy at the grocery store, any type of foods, and they always look the same. So after a while, they do get easier to read. So the way you want to look at them is that you'll always want to check on top. There is a serving size that's been put there by the manufacturer. Then you'll see a line. There's a line that says sodium. There's a number in milligrams. There's a number in percentage. You can choose which number you prefer to use, but the goal is to try to choose products that are lower in sodium. So for example, ideally, the more products you choose that are under 200 milligrams of sodium per serving, or less than 8% of the daily value, the easier it is to stick to that 2,000 milligrams restriction per day. So in this example here, I'll just move my slide here. If you're eating 10 of those crackers, you're having 210 milligrams of sodium. Oops, sorry, can we just go back to the, yep, sorry. If you're eating 10 crackers, you're eating 210 milligrams of sodium. If you eat 20 crackers, you have to double that amount. 420 milligrams of sodium is quite a bit if your meal limit is around 600. So if you're at the grocery store and the box of crackers next to it has 100 milligrams of sodium, well, that's an even better choice. So you want to try to compare things. Always try to find the foods that are lower in sodium. I do realize because of the COVID pandemic, grocery shopping is a bit more difficult because some of us are, not necessarily going to the grocery store because we might be just, someone else is doing it for us, or we're shopping on the groceries websites. So, try your best if you can. The more products you choose that are less processed, the easier, or the lower typically the sodium will be. So you can try to keep that in mind during the COVID pandemic. Okay, so next slide, please. So now we're going to briefly talk about different food groups and which foods are typically lower in sodium. So those are typically all your staple foods. Which foods are higher in sodium? Typically all your processed foods. So if we're looking at grains, staple grains like flour, rice, couscous, quinoa, pasta, barley will typically be lower in sodium. Grains that will be higher in sodium are all the things that are a bit more processed. So salted crackers would be one of them. Frozen waffles would be in there as well. Cake mixes from a box would be in there as well. So all those things that are a bit more processed. Pre-made muffins like the ones that you can buy at the grocery store or at the restaurant could be a bit, or could be quite high also. Keep in mind too with sodium that the quantity that you eat is important. So if you're eating a food that's high in sodium, if you eat a lot of it, the sodium, like the quantity of sodium goes up very, very quickly. So, you know, but the same, if you're eating things that are higher in sodium, but you eat a smaller amount of it, the sodium does reduce a bit. So if you're buying, for example, a muffin and you realize it has 600 milligrams of sodium, by eating half of that muffin, you've reduced it to 300 milligrams of sodium, might make it a bit more manageable during the day. Okay, next slide, please. Fruits and vegetables, or vegetables and fruit. So fruit is okay. Vegetables, fresh and frozen, are absolutely fine. You can have those. Canned vegetables will tend to be quite high in sodium. So you can either rinse them really well under some water to remove parts of it, or you can buy canned vegetables that say no salt on them. So that's one thing you can do. Other things that will typically be very high are all your pickled things, pickles, olives, sauerkraut, all of those, as well as all your vegetable juices, V8, clamato, all of those will tend to be quite or very high in sodium. So you know, definitely want to be careful with them. Next slide, please. So dairy products, milk and yogurt are typically fine. Cheese is a bit more tricky because some cheeses tend to be lower in sodium, but some cheeses can be very high in sodium. I'm thinking of feta cheese particularly, which is in a brine of salt and water. So that's typically very, very high. So for cheese, what's recommended is to not have it, you know, too often, and check the nutrition facts table, try to find cheeses that are lower in sodium because they can tend to be quite high. If we can have the next slide, please. Protein, so, and again, anything that's fresh, not processed much, is low in sodium. So we're talking about things like fresh meat, like a chicken breast, ground beef, pork chops, a whole chicken that you would cook at home would be fine as well. Fish and seafood would be fine. Canned fish, you would want to rinse well under some water or buy a low sodium can. Same thing with lentils, legumes, chickpeas, kidney beans, all of those. If you buy them dry, you cook them from scratch, that's great. If you buy them from again, rinse them well under some water or buy the no salt added can. Nuts you would want to buy without salt, and eggs are fine in terms of sodium. Things that are higher in sodium are all your more processed meats. So we're talking about things like ham, bacon, sausage, pate, smoked fish as well would be part of that. So definitely be careful with those. Try to have more of the less processed types of protein. So for example, instead of having a ham sandwich, maybe try to cook some extra chicken the night before and then using that for your sandwiches. You know, that's something that you can do. We can move to the next slide, please. So it's still important to eat when you have heart failure, and a lot of people find it hard at the beginning to reduce the salt because they're used to it. You do get used to eating more salt. Eventually, though, people also get used to eating less salt. It might take a few weeks to happen, but eventually it does. And there are a lot of things you can add to food to make it taste good and that don't contain sodium. So we're talking about things like spices, herbs, pepper is in there as well, garlic, lemon juice. Your herbs can be fresh, they can be dried. Lemon juice, very good, like I talked about. Green onions, all of those things you can use to add flavor and they don't add sodium. So we can move on to the next slide. So if your appetite is poor, so sometimes that might that might happen, when people have heart failure, sometimes if they're feeling sicker or they're not, doing well, their appetite might decrease. So you might feel that you're feeling full quicker, or that you're nauseous, that you're eating less than usual, and that your appetite's just not quite there. And what can happen if that goes on for a while is that, you'll start losing some muscle mass, becoming weaker, which is not great either, okay? So you definitely want to keep an eye on that. If you notice that your appetite's not good, you feel like you're losing muscle mass, you're not quite yourself and you're feeling weaker, definitely let your doctor know, because it might be a sign that they need to take a closer look at how things are going, maybe refer you to a dietitian to help make sure that you're getting all the nutrition that you need. Because, yes, it's important to watch, your sodium restriction, your fluid restriction, but you also have to make sure that you're eating and that your body's getting all the calories and the protein that it needs. So definitely mention it to your physician. A few things that can help, for example, is trying to eat more often during the day, smaller amounts. That can definitely help. If you're finding it difficult, and that's also something that's a bit related to COVID, but doing groceries and all of that, definitely make sure that you can find someone who can help with grocery shopping. Try to keep foods at home that are easy to prepare so that you don't have to, spend hours preparing. So try to keep things at home that are easy. Maybe some meal delivery services do offer low sodium meals as well, so you can look for those too. Okay, next slide please. So now I'm briefly going to talk about fluids. So when people have heart failure, they're usually asked to watch how much liquids they drink. As a bit same idea as with the sodium. If you drink too many liquids and you have heart failure, your heart's going to have more trouble pumping that out, and you might end up retaining water. Typically the fluid restriction is between 1.5 and 2 liters a day. Sometimes it's a bit stricter than that, but typically that's what we see, and your physician would tell you how much you can have. So that's 6 to 8 cups. And things that count as a liquid is anything that's liquid when it's at room temperature or if it enters your mouth. So anything you can drink, like water, coffee, tea, juice, pop would be in there as well, but also things that would melt if you put them in your mouth. So things like ice cream, jello, popsicles, ice cubes, soup would be in there also. So you can still have those things. You just need to make sure you're not going over your limit. If you do, there's a risk that you'll retain water. You can move on to the next slide, please. So some people, might find the fluid restriction difficult because, they're feeling thirsty, their mouth is dry. I do realize it's very hot outside today. So definitely that might be, something that makes it difficult as well. So to help manage your fluid restriction or make it a bit, less difficult, there's a few little tips that can help. Sucking on frozen lemon wedges, having a few frozen grapes can help hydrate a bit your mouth, making sure your mouth is always nice and clean. So brushing your teeth more often, rinsing your mouth with cold mouthwash, putting some chapsticks or chapstick on your lips can help as well. Some people start chewing gum or have sugar-free candy. You could add a bit of lemon juice to your water as well. It makes it a bit, fresher, a bit more refreshing. So those are all little things that can help manage that fluid restriction if you're finding it difficult. So that's it for me. I'm gonna pass it on to Regan, who's our physiotherapist, who is going to talk about exercise in heart failure. Thank you.
Good afternoon, everyone. My name is Regan, and I'm one of the physiotherapists here at the Heart Institute. And I'm here to tell you a little bit about managing heart failure and exercise during this pandemic. So, next slide, please. Heart failure decreases the ability of the heart to send oxygen-rich blood to the muscles and the tissue and the rest of the body. So the heart just isn't pumping as strongly as it used to. And because of this, heart failure can cause symptoms of fatigue, shortness of breath, coughing, and feelings of heaviness, especially when exercising. The good news is that regular exercise can allow the body to get used to this new blood flow and become more efficient with the oxygen that it is getting. So for many people, this can mean feeling less of those symptoms. Now, I want to clarify that here, when we talk about regular exercise, we mean every day. So that often surprises people. If you're already exercising 2 or 3 times a week, that's fantastic. Keep it up. You're doing great. But see if you can fit it in 5 to 7 days a week. Regular exercise can also help you to reduce stress, sleep better, and feel more confident, and ultimately feel more in control of your health. Next slide, please. Most people find it hard to get started and stick with regular exercise, so you're not alone there. We all have that challenge. But that difficulty seems even greater right now during the pandemic. But the truth is that exercise right now can be safe and easy as long as you prepare and take the right precautions. And we'll talk about those shortly. So just remember that even though times are not what we're used to right now, don't be afraid to continue your exercise habits or maybe create a new one. Next slide, please. So walking is one of the best cardiovascular exercises you can do, whether you have heart disease or not. We usually suggest people start with walking, but if walking isn't for you, find something that is. And really, exercise doesn't have to be strenuous to be valuable. So keep that in mind. The important thing is that you do a little bit every day. Start with what feels manageable for you right now, and you'll build your endurance from there. Next slide, please. So this is a sample walking program that we recommend for our heart failure patients. Your goal here is to eventually work your way up to 20 or 30 minutes per day, but keep in mind that everyone is different and you should really listen to your body as you progress. So this program progresses very gradually and focuses on building your walking time or your endurance. So for the first 2 weeks, try to walk whatever length of time you are able to do right now. So let's say that's 5 minutes. So 5 minutes every day. Keep it easy. This shouldn't be hard or exhausting. And as you work at your walking, as you approach the 2-week mark, you may notice the walk gets a bit easier. This is your body adapting and getting more efficient. And that's your cue to slightly increase your walk time. So maybe for the next 2 weeks, you can walk 8 minutes instead of 5 minutes, or whatever feels right for you. But again, keep it manageable. And you're going to keep going this way 2 weeks at a time, gradually increasing your walk time until you notice that things start to level off. Don't worry if you need to slow it down or take a break or change things. Listen to your body and change your exercise accordingly. Everybody is different, and some people feel well building their endurance up to 15 or 20 minutes only daily, while others are comfortable at 45 or 60 minutes daily. So just do what feels right for you. Remember to start and finish your exercise session with a warm up and cool down. This could be slower walking for a couple minutes before you start, or maybe even some exercises in the chair, getting your arms and legs moving before you start. Next slide, please. So if you find it difficult to walk without frequent rests, you may want to consider an interval program, alternating short periods of walking or exercise and resting. So start with an interval of walking that you can manage. Let's say that's 2 minutes, and follow it with a 1 or 2 minute rest. Repeat the pattern as many times as you're comfortably able. And you can always change the numbers of minutes to suit your tolerance or that work for you. And then you would add up the total number of walking minutes in one session to reach your goal. Next slide, please. So if all of this feels much too much for you, then another way to get started is by simply walking in your chair. You can march your feet or kick them out one at a time, or even just lift your heels and toes. The important thing is that you're doing some kind of exercise every day. Next slide. Some of you may prefer to exercise outdoors, and that's perfectly fine. You just need to be mindful of a few things. So remember to always follow local public health guidelines for appropriate use of masks and physical distancing, even when you're outside. Here in Ottawa, public health currently recommends maintaining 2 meters or 6 feet distance from people you don't live with. As well, they recommend wearing a cloth mask when in public places like the grocery store, especially if physical distancing is not possible. So keep that in mind when you're outside. Many of our paths and walkways are narrower than 6 feet. So when you're crossing somebody on the path, you want to be mindful of that. And so also the other thing to mention is that wearing a mask can feel a little restrictive for some. So it may really impact your breathing having that mask over your mouth. So the best thing would be to avoid those busy areas when you're exercising so that you don't have to wear a mask. If taking your mask off isn't an option and you do find it restricts your breathing, then you'll need to adjust your exercise intensity or pace. So slow it down so that you can breathe comfortably, or as we just discussed, try an interval program so you have those breaks in between. Another important thing to consider about exercising outdoors is weather. Extreme temperatures like hot, humid days like we have today, as well as very cold, slippery weather, puts extra demands on your heart. So finding an indoor option on these days is a good idea, or try to go out when the weather is best. So like a day like today, hot and humid, consider exercising early in the morning or later in the evening after it has cooled off and the sun's gone down. Next slide, please. So exercising indoors, there are a lot of reasons you might choose or need to exercise indoors. So maybe due to weather, or perhaps it's for social distancing, or maybe you just prefer exercising indoors, and that's fine. Well, whatever your reasons, there are a lot of different ways to stay active indoors, even if you can't use a public gym. So consider walking in the hallways of your home or your apartment building. There are also thousands of exercise videos and audio sessions online. So many are low impact and designed for people with chronic illness. So you have to dig a little bit, but there's lots out there. And of course, we already talked about chair exercises. So that's another great way. If you have access to a treadmill or a stationary bicycle, you may use that, but don't put any tension or incline on the treadmill. And if you've never used one before, make sure you have some help to coach you that first 1 or 2 sessions so that you get used to it. And of course, be sure to disinfect all those surfaces before and after you use it, and always practice physical distancing. So next slide, please. So I also want to mention that the Heart Institute has a newly released exercise application called HeartWise. So this is an app you can use from your phone, tablet, or computer. And following a few brief questions, the app is going to guide you through a daily exercise prescription that is specific to your needs and will help keep you on track safely. It's free, so that's a win. And you can find it here at this website we've got up on the slide. Next slide, please. So a question I often hear from people is, how should this feel, or how hard should I be working, or how fast should I walk? And the usual answer is listen to what your body is telling you. I find that sometimes our brains and also our habits try to do too much too soon or too much too fast. So try using the walk and talk test. So this is a test, very simple. So you should be able to carry on a light conversation while you're exercising without losing your breath. If you find you have to talk like this, then you know you're working too hard. You should stop, catch your breath completely, and then begin again at a slower pace. Don't feel you need to push yourself through that breathing. It shouldn't be hard. Instead, pace yourself, go slow, and take breaks. We're not as concerned about speed or distance here. What's important is really the length of time you walk, so your endurance. That's what we want to build. Also monitor how exercise makes you feel later that same day, as well as the next day. See how your body reacted to that exercise. And if you feel well enough and you feel you have the energy, you can exercise twice a day if you like, but really once is just fine. So don't feel you need to do 2. Next slide, please. So remember, this is just a reminder, you should stop if you feel any of the signs listed here or any discomfort while you're exercising. If these feelings don't go away with a short rest of 5 or 10 minutes, then you need to get emergency medical help. So that means calling 911. Don't be afraid to go to an emergency department. Waiting to get medical attention right now, you're risking your heart disease getting worse. So please, if you feel any of these symptoms and they're not going away, get some help. Next slide, please. Conserving energy. So since heart failure often causes you to feel tired, it's important that you think about conserving energy throughout the day. So some strategies. When you're out exercising, if it's not possible for you to avoid hills, then slow your pace right down when you go up and take breaks as you need them halfway up. Wait before exercising after you've just had a meal. Your heart is busy with digestion at that point, so let's not ask it to do two things at once. Give it 45 minutes to an hour to digest. Consider what activities you might do seated instead of standing, so things like food preparation or brushing your teeth. If you have stairs in your home, try and organize your time so that you don't have to go up and down 10 times in a day. So try and plan fewer trips, plan ahead. Avoid lifting heavy things. So we're talking 5 or 10 pounds. Avoid lifting them up above your head. Try and keep them at chest level, or better yet, try and find somebody else to do it for you. But also we want to avoid holding our breath. So that's something we do when we're lifting heavy things, is try not to hold your breath, because that puts added pressure on your heart. Equipment like walkers, canes, shower chairs, reachers, and long-handled shoe horns. These types of things can help you save energy, and they're available at all medical equipment supply stores. Overall, it's really important to prioritize your activities, plan ahead, and pace yourself. Next slide, please. So motivation, that's a tough one for all of us, so you're not alone there. Choosing an activity that you like is important. If you don't like walking, you're not likely to stick with it. So we need to find you something that you're going to enjoy and want to go back to. It always helps to have company. So inviting a family member or a friend, socially distanced of course, can often help. You may choose to do this from home or using a video call or talking on the phone while you're exercising. These can be great ways to pass the time while you're getting a walk in. Scheduling your exercise is another good one. Booking the same time every day. 10:30 is my walk time, and that's when I'm going to go. Also, if you think of it as a medical appointment, part of your treatment, then you might be more likely to follow through. See what kind of videos, challenges, or apps you can find online. Listening to books on tape or podcasts while you exercise is another great way to keep you busy. The new HeartWise app, of course, the exercise app, it was designed specifically for individuals with heart disease. So give that a try. Some people like to keep notes on what they've done, and that can be really motivating a few weeks later when you come back and see how far you've come. So finally, never hesitate to reach out to an exercise specialist to help you find what's right for you, and you might actually discover something new that you like. Next slide, please. Consider joining a cardiac rehab program near you. A multidisciplinary team can help you achieve optimal heart health by addressing all your cardiac risk factors. And there are programs all over the region, the province, and even the country that we can refer you to, including on-site programs, telephone programs, and virtual programs. So if you're eligible to participate, we will reach out to you, but feel free to give us a call here at the rehab program. Next slide, please. So in summary, when you're dealing with heart failure, even though exercise can sometimes seem daunting, in the long run, it will help you feel better. Try to do a little bit every day. There's no hard and fast rule about how much to do. Just do what you can manage, and you'll build on that. Whether you're exercising indoors or out, continue to follow physical distancing measures. And if that's not possible, then wear a mask. And finally, the most important, in my opinion, is listen to your body. Pay attention. Only you know how your body feels when it's not well. And you also know when you're starting to feel better. So listen to that. Thanks very much for listening. I think we have Dr. McGinty next.
Change the camera. Hi, everyone. Thank you for having me on today. So I'm going to continue talking about living with heart failure during the COVID pandemic. Next slide, please. So it's important to recognize how prevalent heart failure is in Canada. So we know that there are approximately 40 million people affected by heart failure worldwide and 600,000 patients in Canada who have heart failure. It's very expensive in terms of hospital cost, as there are multiple admissions and hospitalizations associated with heart failure every year. And it's actually the #1 driver for unplanned hospital admission. And unfortunately, the prognosis with heart failure is quite poor. So 50% of patients diagnosed with heart failure will die within 5 years. And so it's very important to continue with good medical management, which we know can improve your lifespan and also improve symptoms. Next slide, please. So what is heart failure? Your heart is a muscle that provides blood to the rest of your body. And so heart failure occurs when your heart becomes weak or damaged. And that can be from any number of causes. So blockages in the arteries with heart attack can be one. Genetic causes exist as well. And so when your heart becomes weak from whatever cause is underlying that damage, your heart is no longer able to supply your body with the blood and the oxygen that it needs. And this over time causes your heart to work harder and work less efficiently. And eventually this results in fluid which backs up in your lungs, your abdomen, and your legs. And this are the symptoms that Lindsay was referring to earlier. Next slide, please. Ejection fraction often comes up when we're speaking about heart failure. And ejection fraction is really how we define the types of heart failure that we manage. So the ejection fraction is a measurement of how much blood is pumped from the left ventricle with each contraction of your heart. And we typically measure this with an echocardiogram, although it can be measured with other tests such as an MRI. And so you'll see here on the right with this image, it's just a measurement of the amount of blood that's pumped out as compared to the amount of blood in the chamber. Next slide, please. And so on the right, you'll see that we define heart failure based on your ejection fraction. And so we call heart failure with preserved ejection fraction, heart failure in the setting of an ejection fraction that is greater than 50%. So typically normal is 50 to 70%. Heart failure with mid-range ejection fraction, which we also sometimes call HEF-MEREF, is an ejection fraction of 41 to 49%. And then finally, heart failure with reduced ejection fraction is an ejection fraction of less than 40%. So you can in fact have heart failure even with a normal ejection fraction. And the medical treatment of heart failure is based on the ejection fraction. So depending on where you fall in these three categories, this will define what type of medical therapy is best for you. Next slide, please. To continue on what Lindsay was presenting earlier, so there is what we call triple therapy, are the medications that were presented earlier. And so these are the medications that are always used as first-line therapy, but there are newer agents now that are being added on to those three therapies, which I will talk about briefly. Next slide, please. So the first is a medication called sacubitril valsartan. It's known by the trade name Entresto. It's a combination drug. It's a combination of a neprilysin inhibitor, which is sacubitril, and an angiotensin receptor blocker, valsartan. And what it does is it widens the blood vessels, and it also helps the body get rid of extra salt and fluid. And so this medication is often used to replace either your ACE inhibitor or your ARB, the angiotensin receptor blocker, once you are on a very good dose of that medication. And so we typically will transition you from an ACE or an ARB onto Entresto. And this medication has been shown to decrease death from heart failure. It lowers the risk of hospitalization for heart failure, and it also improves your overall symptoms. The side effects that are important to recognize are dizziness and lightheadedness, as it decreases your blood pressure. It can increase the blood potassium level and worsen kidney function. And so it's important to monitor blood work, particularly the kidney function and the potassium, while on this medication. Next slide, please. Ivabradine is another medication that gets added on to the original medical therapy that we were discussing earlier in today's talk. Ivabradine, also known as Lancora, is an inhibitor of what we call the funny channel in the heart, and it works to slow down your heart rate and reduces the work of the heart.
And this medication, again, has been shown to improve heart failure symptoms, decrease death from heart failure, and reduce hospitalizations. Common side effects are visual changes with light, blurred vision, dizziness, headache, and high blood pressure. Next slide, please. The last medication that I want to talk about today is called an SGLT2 inhibitor, and these are becoming more and more commonly used because they have been shown to have significant benefit in patients who have heart failure, both with and without diabetes. And so it is a medication for the treatment of diabetes, and it lowers blood pressure, but it has been shown to have significant benefit in patients who also have heart failure. And so it can be used.
Oh. Attention. Attention,
Sorry.
code stroke, emergency recess, code.
Sorry about that. So this medication is now recommended for patients with heart failure, whether they have diabetes or not. And it importantly can lower your blood pressure. There is an increased risk of yeast infections and urinary tract infections that's important to recognize when this medication is started. Next slide, please. So finally, living with heart failure during the COVID pandemic, it is very important to continue to seek medical care if you need it. And so it's very important to watch for symptoms of heart failure. And so those symptoms, for example, worsening shortness of breath, coughing, fatigue, weight gain. And so again, the importance of weighing yourself daily and recognizing a weight gain of 2 pounds over 2 days or 5 pounds in a week as being significant. A bloating sensation in the abdomen, swelling of the legs and ankles. And particularly if these symptoms are significant, then please go to the nearest emergency department or seek medical attention with your cardiologist or your family doctor. Despite the ongoing pandemic, we know that the risk of heart failure continues to be very high. And so the risk of heart failure can actually outweigh the risk of contracting COVID. So it's very important to seek medical attention if you do have worsening symptoms. Thank you.
Great, thank you so much, Dr. McGinty. I'd like to invite all of the panelists to come back for the Q&A portion of the session. I would like to remind presenters, the audience, that if you have a question, please type it in the Q&A section of the Zoom, which you'll find at the bottom in your black bar. So our first question is for Regan. Somebody's asked, where can I find the HeartWise app that you were talking about?
Good question. So we did put up a web address on the slide. Oh, hello.
Yeah, sorry, we can hear you.
So we did put up an address on the slide. It is heartwiseapp.ottawaheart.ca. So I don't know if we can maybe flip back to that slide, or I can just repeat that, heartwiseapp.ottawaheart.ca. And there you can sign up for the app and then use it that way. So it's not available on the App Store or on Google Play. It's only available through that link.
Great, thank you so much.
You're welcome.
Our next question is for Anne-Marie. Somebody's asking, what's the difference between table salt and sea salt, and is there one better than the other?
I forgot to unmute my mic. So that's a very good question. So there's no real difference. The difference is in the way it's like made, so the way it's manufactured. But in terms of sodium content, they're the same thing. So they're both made of sodium and of chloride. They both contain similar quantities of sodium per teaspoon. So no, there's not one that's better than the other. And they're both high in sodium. So we do recommend that you know, that you try not to use it and try to flavor the food more with things like herbs, spices, lemon juice, pepper, etc. And so this applies to, you know, table salt, sea salt, but also all the other salts that we see all there, so, like out there, like Himalayan salt, pink salt, gray salt. Like there's a bunch of, you know, types of salts out there, but in terms of sodium, they're all pretty much the same thing. Salt is salt is salt. So that's it.
Wonderful, thank you. Our next question is for Regan. Is golf considered exercise?
So good question. The golf let me rephrase that. Golf can be great exercise if you choose to walk. And sometimes it's too much walking, but when we think about cardiovascular exercise or aerobic exercise, we're thinking about moving continuously, keeping our heart rate a little bit higher, but for a continuous period of time. So with golf, you're going to be stop and go, but those periods of walking in between holes can be pretty valuable. Usually we're talking about, you know, bouts of 5 to 10 minutes, and that's going to be valuable to you. But if you're in a cart, then you're not really doing a whole lot of aerobic exercise. Hope that answers.
Yes, that's great. Thank you. The next question is for Dr. McGinty. One of our attendees wants to ask about the statistics on life expectancy. If EF maintains itself over 50% with no symptoms, is the life expectancy of 5 years still applicable?
Good question. So the life expectancy, we know, applies to both patients who have heart failure with preserved ejection fraction and also heart failure with reduced ejection fraction. And so we know that the two groups have been compared and are similar in terms of prognosis. And so it's important for both groups, although we tend to have less medical therapy available for patients with heart failure with preserved ejection fraction. Every therapy that was mentioned earlier today is really for heart failure with reduced ejection fraction. The key when you have preserved ejection fraction is to manage risk factors like high blood pressure and diabetes. And so it's important to manage all of the things we've mentioned today to improve symptoms and also your life expectancy.
Great, thank you so much. One of our audience members, this would maybe Anne-Marie or Regan or anybody who can answer this. So somebody's asking on fluid intake. So 2 liters seem very low given the outside exercise and hot weather. Example for long ride would be very dehydrating. Can you drink more than 2 liters?
So if you want, I can start answering the question and then maybe Dr. McGinty can pitch in. So the fluid restriction from 1.5 to 2 liters, so it's meant for people with heart failure. So if you do have heart failure, your physician will typically mention how much fluids you can drink. And, you know, yes, if it's hot outside, you might, you know, sweat a bit more, but typically you might think you're sweating a lot, but you're not sweating out cups and cups of liquids. So it's not enough for you to really, you know, drink more. So if you've been told by your physician to, you know, follow a certain fluid restriction because you have heart failure, it's best to probably, you know, stick with that. You can always mention it to them, but usually we don't, you know, tell people if it's really hot, drink more, because you're not, you know, you're not sweating enough for it to make a big difference in how much your body can handle and how much your heart can handle if you need a fluid restriction. I don't know if Dr. McGinty has something else to add to that.
I agree with that. Generally speaking, respecting the fluid restriction is important no matter the season. Even if it's hot outside, generally, as you just mentioned, sweating is not a significant component. And so the fluid restriction remains. And so it's important to try other ways to keep your mouth, so to fight the dryness in your mouth with other things like gum or even some sugar-free candies, things like that. Using ice chips, which of course contribute to the total count. just to manage the dry mouth. But yeah, the fluid restriction should be maintained in almost all cases.
Great, thank you so much. So that's it for questions, for time for questions today. I'd like to thank all of the presenters and the panelists for joining today's webinar, and I want to thank the audience for attending today and learning more on living with heart failure during the COVID-19 pandemic. If you have a question that wasn't answered, I would invite you to email us at heartwisewebinars@ottawaheart.ca, and we will forward it to the person that can answer as soon as possible and get back to you. We'd also like to invite you to visit our website at pwc.ottawaheart.ca to view this recording, view other recordings of different webinars, other resources available for living with heart disease during the COVID-19 pandemic, and much more. I'd also like to remind everybody that there will be a short survey popping up in your browser when we end the webinar, so please take the time to answer. We do take your feedback very seriously and use the feedback that you give us to improve the educational experiences that we offer. And finally, we also like to reiterate to please do not ignore your heart symptoms. If you have some, if you or your loved one are experiencing heart symptoms, please visit the emergency room or call 911. There are additional measures to ensure your safety, so please do not ignore your heart symptoms. Other than that, that's it for today. I'd like to wish everybody a wonderful hot afternoon.